ഇന്നത്തെ കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റിൽ നമ്മുടെ കൂടെ ജോയിൻ ചെയ്യുന്ന ഡോക്ടർ മുഹമ്മദ് ഫയാസ് പാഷയാണ്. ഡോക്ടർ പ്രോസ്റ്റഡോണ്ടിസ്റ്റ് ആണ്. സ്മൈൽ ഡിസൈനിങ് ആൻഡ് ടീത്ത് റീസ്റ്റോറേഷൻ ഈ ഒരു വിഷയത്തിനെ കുറിച്ചാണ് നമ്മൾ ഇന്ന് സംസാരിക്കാൻ പോകുന്നത്. നിങ്ങൾക്ക് എന്തെങ്കിലും ഇതിനോട് റിലേറ്റഡ് ആയിട്ടുള്ള ജനറലി ഡെന്റിസ്ട്രിയോട് റിലേറ്റഡ് ആയിട്ടുള്ള എന്തെങ്കിലും ഡൗട്ട്സ് വ്യൂവേഴ്സിന് ഉണ്ടെങ്കിൽ നമ്മുടെ ഫോൺ ലൈൻസ് എല്ലാം ഓപ്പൺ ആണ്, നിങ്ങൾക്ക് വിളിക്കാവുന്നതാണ്. Doctor, good afternoon and welcome to the show.
Good afternoon.
Yeah. Doctor, we know there are different branches coming under this dentistry and we have heard about many names. But what all comes under the purview of prosthodontics basically?
Okay. Generally, dentistry comprises, we know that, of basically related to teeth problems.
Yeah.
But we do have branches in dentistry related to the different, areas of the teeth itself. And when it comes to my branch, that is prosthodontics, it mainly deals with replacement of any missing structures.
Okay.
So those structures include missing teeth, which is very, very common after we remove the teeth. Then sometimes we do have some special cases where there will be missing palate, like some children born with cleft palate, cleft lip cases.
Okay.
And sometimes we do have cases after cancer treatment or carcinoma which happens, we call it as cancer. After cancer surgeries, there will be a part of the tissues will be removed from the mouth, like the palate or the lower jaw or the tongue or something like that. So we do replace those things also.
All right.
And to go a little extra, so sometimes if there are some missing structures on the face, say like a part of the nose or ear or something, or the eye or something like that, we deal with replacing them also artificially. So that is called prosthetics. Prosthetics is basically replacement of any body missing body, any missing structure in the human body.
Okay.
But when we add prosthodontics, so we add teeth to it. So this is a specialized branch. It's actually one of the oldest branch in dentistry. For replacing teeth and missing, because since the human being exists, so there are teeth problems, there are missing teeth and things like that. So we do have a lot of history of prosthodontics. Dates back to Egyptian civilization, Mayan civilization, where they have carved some artificial teeth of ivory and gold and try to implant the teeth with using the wires and all. So we do have a lot of history.
Okay.
That's why we say it's one of the oldest branch of dentistry. So but in general, mainly we deal with replacing any missing structure in the oral cavity and in particular teeth.
So what are those conditions where one can approach a prosthodontist?
Yes. See, the prosthodontist will come into picture actually when we decide to remove a particular tooth. So it's not after the tooth is removed prosthodontist should be seen, but when you decide to remove a tooth, then itself we call it as pre-prosthetic planning.
Okay.
Before we remove the tooth, we would like to know what kind of replacement we want.
Okay.
If patients speak with general dentists and they refer to prosthodontist, so then it will become very, very easy, and it will become the whole treatment can be planned very well. We can give multiple options, and overall the treatment will be very successful, especially if the tooth is missing or tooth has to be removed in the front part of the the front teeth, the front or lower, because once we remove the front teeth, we can't go socially and we can't face people, so that will decrease your confidence. So in that cases, if patient comes to us in that stage, it's really, really helpful to make a pre-prosthetic planning. Then we can do the extraction, that is removing the tooth. Then definitely we have different options. And if you ask me what are the options, so there are 3 to 4 options.
All right.
So if I take up a patient who just want a simple removable tooth, who's not economically sound, so that time we can just give him a removable tooth or something called as a flipper, or a removable partial denture. So we can give him, and or he can just use it every day and remove it. The other option would be to have fixed teeth, which most of the patients would prefer to have fixed teeth. And when it comes to fixed teeth, again we have some options. We can either take the support of the other neighboring teeth, and we can do some, endodontic procedure if those teeth are not strong enough, and or they have some dental caries or other problems. We can make them strong first, then we can take the support and we can do something called bridging the. It's called fixed partial denture. The bridging the teeth can be done. So we take the support of the neighboring. So these are the options for the fixed. So of late, from past 30-40 years, dental implants have become very famous. Implanting the teeth. So in implanting the teeth, basically we don't want to touch the other. For example, if one upper tooth is lost in accident, or if you have a fall or something like that, then we can implant a tooth. Means we can take a titanium screw and we can put it there in the bone, which acts like a metal root, and we can fix a tooth to it. So that is called implanting a tooth, and that is also a permanent procedure. It lasts for many years and has to be maintained, of course. So that is called implanting a tooth, and that can be done any part of the upper and lower jaw for the missing. So these are all the things a prosthodontist wants to do. Planning basically. Now I'm talking about only a simple condition, a missing tooth or something like that. We do get cases where there will be multiple missing teeth. So a lot of people start removing the teeth. Earlier the concept was, in many places where the dentistry was not developed, so the concept was, if they get a tooth pain, remove the tooth. So we do get a lot of old patients, aged patients, so who have removed a lot of teeth over a period of time. So those patients require multiple teeth replacement. So in those cases, things will become a little difficult. So sometimes we have to do removable teeth because we will not have support or any tooth in the mouth. Sometimes we have to do combination. Sometimes we have to plan for something other procedures, like making a more saving the existing teeth already by restoring the teeth and doing the other procedures, and replacing the teeth. So those are all the different things. Again, everything depends on case to case. But generally we have to look into strengthening the existing teeth and having a plan for missing.
The dentures, what are the dentures?
Yes. See, the dentures are replacing missing teeth. So dentures can be fixed or removable. So if you want to have a fixed denture, it's called fixed denture. Mainly we do fixed dentures for smaller teeth, 1 or 2 teeth missing, we do fixed partial denture. But in removable dentures, we can do removable partial denture for few teeth missing, and if all the teeth missing, there are no teeth in the mouth, then we do something called complete denture that replaces entire teeth completely. This is all the dentition. Basically, complete denture comes with upper and lower plate, where we have upper tooth completely having the teeth attached with the plate, and the lower denture which comes and sits on the lower jaw, and we train the people to wear the denture and how to use it and how to speak, how to eat. That requires a lot of cooperation from the patient. So those are the complete removable dentures. And if you want to do something called complete fixed dentures, so that's when we use implants, those titanium screws which are inserted into the jawbone, and we use them like pillars to construct the dentures over them. So we can fix the dentures also. So the dentures are nothing but replacing the teeth, which act like teeth in the absence of teeth.
All right.
That's all.
So now, Doctor, we were discussing about implants before. So
Yeah.
can you please explain about dental implants more?
Yeah, dental implants are basically used
Mm.
to replace the missing teeth. As I said, implanting the teeth, that's what commonly called as. Basically, when the teeth are missing, we try and place dental implants into the jawbone, and we take the support from those dental
Okay.
implants. They are basically titanium screws,
Okay.
and within a few months, like for example, for the lower jaw, 3 months,
Mhm.
we leave the screws there, and
Okay.
for the upper jaws, up to 6 months, we leave the screws there.
Mhm.
And in 3 to 6 months, these titanium screws are anchored to the bone,
Okay.
like they are part of your body.
All right.
And then we, attach teeth to them,
Mhm.
and those teeth will act as permanent, teeth, and they are fixed teeth, and you can use them for, chewing and
Okay.
regular daily activity.
Okay.
So these are called dental implants.
Okay.
Now, for a period of time, like from the dental implants which came, which were introduced, early in 1960s, 70s, then in the Western world, and slowly it spread over the world, and now it's become one of the important treatment modalities
Okay.
for missing teeth.
Mhm.
So dental implants are used in for various scenarios now,
Oh.
starting from missing single tooth
Mm.
to replace complete set of teeth. Dental implants are used today,
Okay.
and we do also have quick solutions with
Okay.
dental implants.
Mhm.
Something called, you must have heard, tooth in an hour,
Okay.
teeth in a day,
Oh,
or
okay.
something like that.
Oh.
So with a proper planning,
Mhm.
good case selection, so sometimes we can do a procedure
Mhm.
in 1 hour or 2 hour,
Okay.
and we can replace a tooth,
Okay.
and we can put back, especially in the front area. We call it as aesthetic zone,
Yes.
the front area where the teeth are visible when we
Yes.
speak. So in that area, in those situations, these dental implants are very helpful, and we
Correct.
can place the dental implants, and we can immediately place front teeth.
Okay.
So that is called immediate loading
Okay.
of teeth on dental implants, and we can leave it for some time, and we can replace later with the more permanent
Okay.
teeth.
So these are permanent options, right? The implants what you
Yes,
do. So
yes.
how about the maintenance of this?
Yeah, generally the maintenance protocol, what we call it as the home care protocol, so it has to be followed. Basically, there are two things. One is the regular home care procedures like toothbrushing,
Okay.
flossing, using or mouthwashes and things like that. Keeping basically your gingiva, that is your gums, healthy.
Oh.
That is very important. And the second important thing is habit.
Okay.
So people having these kind of procedures, dental implants and artificial teeth, so they have to check their habit. So especially smokers, it's very, very dangerous.
Okay.
Because once there is a lot of smoking happens in the oral cavity due to the nicotine and
Correct.
also the hot smoke and things like that. They are not good to our gums, not good to our bone and
Okay.
teeth. That's where damages will start happening.
Okay.
So again, the other habits like chewing tobacco and those
What all dangerous
the
for health? It's hazardous for your teeth as
exactly,
well.
exactly.
It's a whole set. Like it's all
exactly,
dangerous for your total health.
yes.
So these people they can use the regular toothpaste after this implant, or there are special toothpaste for it?
No, most of the time we advise them to have just the regular toothpaste what they use, every day for that.
Okay.
There's a good thorough cleaning. Make sure that every time you eat, especially refined food or something like that you eat, or fiber food,
Okay.
so or sticky food or whatever
Okay.
different type of food you eat, to make sure that you clean it properly.
All right.
Nighttime brushing is more important than brushing in the morning,
Oh.
because in the night, because of less salivation, you'll have more bacterial activity and different the process of bacterial activity will increase in the night. So it's very important that we brush in the night, and especially we should allow our children to brush in the night without fail, and we ourselves also should brush. When I ask my patients, if I ask, say, out of 10 patients, if I ask how many of you brush in the night, at least 5 will say we don't.
Exactly.
So, there itself we can say 50% people are not brushing.
Correct.
But nighttime brushing is important for maintenance.
Now, if we come to the aesthetic part of dentistry, I think which is a very beautiful invention, smile designing.
Yes.
So, coming to smile designing, what exactly is this smile designing?
This smile designing is like, as the name says, we are designing smiles.
Correct.
So basically, when we speak people, basically first we greet them with smile, and we want to have a pleasant smile.
Correct.
And when we have a pleasant smile, teeth are seen.
Yes.
So we want to design teeth in such a way that the teeth should go in according to your pleasant smile. So probably you'll have a lip, we'll see a lot of things in smile designing, but generally what we want to have a pleasant smile with nice looking teeth, shiny teeth, white teeth, or whatever you call it as, level teeth or something like that. So that's what basically we do it. So to do the smile designing, we understand the anatomy of each tooth in detail. So at a very, very say micrometer level, we understand how the teeth morphology is, how the teeth anatomy is, and how they should look, if they have to look perfect. This is what we understand, and we try to put this idea into the existing teeth, which may not be perfectly made, because say 90% of us will never have a perfect alignment of teeth, except few lucky ones. So in those cases we can help them to design their smile, and we can basically in smile designing, if you ask me, so there are two things. One is doing it naturally, and one is doing artificially. Generally smile designing means we do use a lot of something called veneers or laminate they call us, and we do design smile designing. But if you take a very broad aspect of smile designing, that is making your teeth look nice, so personally I prefer do it naturally. Probably if there is an option, we should go for a natural way. What is natural way? You can do orthodontic treatment. You can take help of your orthodontist, which again other specialty in dentistry. So they will align your teeth naturally. So so they put the braces, they call it as fixed orthodontic appliance we call. So braces they put, especially you must be seeing a lot of children, and teenagers, and they have those braces. So basically we want to align the teeth in a natural way. If the teeth morphology, color, everything is good, so we can align it. And in adults, and especially for individuals who really demand that kind of good smile, or say more people who face camera every day, like models or actors, TV anchors, many people who face camera, they want to have perfect smile. For those people, we have to really do a very good job with aligning the teeth. That's when we do, this is called smile designing. In that, what we do basically, we see the existing teeth, and we see where are the flaws, where are the problems, and we try and design, or we take some good design of the teeth and put it on them, and we see how it looks. It's called mock-up. Mock-up means without actually doing, we do it on the model.
Like a prototype.
Exactly. We do it like a prototype, and we show it to the patient. Now with the help of technology, we can do something called virtual smile design.
With the help of
computers with technology, we do virtually now. So within few minutes, we can just scan your teeth, you scan your smile, and we can put our designed veneers or laminates, and we can show you, and we can see how it looks on your teeth and on your face in general and all that. And once the patient accepts that smile, once he accepts that design, then we can convert it into actual one.
All right. So what are the factors that you consider while selecting a design for a particular patient?
Yes. So we do consider a lot of factors. We broadly classify them as extraoral and intraoral factors. If you talk extraoral factors, we see how the lip is. We call it as lip line. So when you rest, how your lip line is. When you talk, to what extent your lip goes up and how much your teeth are exposed. And when you smile, how much your teeth are exposed. When you smile widely, how much your teeth are exposed.
Correct.
So all this will come into picture, and length of your lip. And so some people will have short lip. If they have short lip, the gums are seen when they speak.
Correct.
If they have good adequate length of lip, then it looks pleasant.
Correct.
So people with short lips, the problem will be more, because we have to mask somehow the things like that. So we have to see a lot of factors.
The gums as well, or you do something for the gums?
In some cases, we do have to cut the gums and make the teeth height, because if the teeth are small, so as I said, each case is different. So we have to analyze a lot of things, and the nose, how you have your overall personality, then the way you speak, and how much lower teeth are exposed, upper teeth are exposed. All these we look into extraoral factors. Then intraorally, once we go inside the mouth, then we come into this, how much of gums are exposed or they are not exposed. Then the teeth size is very important. Whether we have to increase the tooth size, or it is adequate, or we have to reduce the tooth. So that we have to look into it. Then if there are any gaps between the teeth, that we have to look into it. Then the angulation of the teeth, if the teeth are not straight or curved or something like that, do we have to straighten them? That we have to look into it. Then we also have to look if there are any other problems like dental caries, or there is any fracture of the edge of the teeth, there is a breakage, there is attrition, due to usage of teeth. Generally teeth will have wear and tear. So if there is any reduction in the size of the teeth, all those we have to see. So seeing all these things, we write down all these problems, extraoral things, intraoral things. Then we need to relate everything, then make a proper plan, design, show it, get approval, then go on actual. So it's a process.
It's a process. And generally, how long does it take if you are a smile designing? How long does it take for a patient? I believe it won't be finished in one sitting.
Yeah. See, with having experience of 15 years in the field, I can do a virtual smile designing within 15 to 30 minutes.
Correct. And the execution of that?
If we have to execute it, then we need to do something called preparation of the teeth. Then we need to make measurements. Then we need to fabricate them in the lab. Generally we fabricate in the lab, not in the clinic. And then we bond it, or we fix it to the teeth. And the overall process should, even on a fast track, if you do it without much complications, for a simple case, I think within 4 days to a week we should be able to finish it. Again, if there are factors which are taking time, like restorations, or if you want a root canal treatment for a tooth which has dental caries or something like that, discolored tooth or something like that, that's when the time will add up, because we need to send them for other specialists. So they have to finish the treatment, then they have to come back, and this is. So, but for simple cases, I think in a week we can easily finish it. And nowadays we have something called snap-on smile. Snap-on smile is party wear smile.
All right.
So you want to go to a party, and you just want to wear a smile only for a party. You don't want to go for the veneers.
Correct.
Because it's time consuming, long procedure, expensive as well. Exactly. So we have come up with something called snap-on smile in our field, where you can just wear those removable veneers, full set, and nicely smile, and go to party and enjoy, and come and remove it back, just like your makeup. So those are catching up really, and we do fabricate in our center, and a lot of people do come for that, and it is very, very simple.
So for that, it's like we have to visit a prosthodontist for that, and you will fix it. basically.
Yeah, basically any dentist can do it,
Okay.
but with the specialists in the occlusion and the related structures, and any aesthetic dentist or cosmetic dentist who's trained in that field can do it.
Okay.
But we do deal with serious problems. This is a
Okay.
simple thing.
Okay, but this thing,
but
this
we
is something interesting, I
very
believe,
interesting.
especially for ladies, because it's you can wear it like
Yes.
a makeup. You said.
Yes.
So how long does it last, basically, if you put this, semi-permanent or temporary?
The snap-on smile, what I was talking, the party wear
Yeah.
smile, you can just wear it and remove it, and you just maintain it nicely. You see, that will destroy if you don't keep it properly.
Okay. So that
And it is
itself we can
delicate also.
Use
So-
it again. The
so
same
yeah,
thing we
you can use it again.
Oh,
Keep it in a box. We do give a small box to preserve them. This thing, they are very delicate also. You can't just play it with that. It'll
Okay.
break, because we need to really make it very thin.
Yeah, because you're
Because
fixing
nobody
on
should
the,
be make out
existing teeth.
existing teeth.
Yeah.
Exactly. They are like, you can say, the paper thin.
All right.
It's
Okay.
very, very thin.
Okay.
So they can just wear it and remove it. It's very, very
Okay.
easy.
All
It
right.
just hardly takes 2 seconds to wear it and remove it, wash it and store it. And they are really, really becoming famous.
Okay. Correct.
And I have made one for myself.
Oh, really?
And I do use
hope
it. It
you are
looks
not.
good.
You are using that one
Yes.
now. Wow,
No, I'm
that's
not
great.
this thing, but it's really good. It's really catching up.
Oh,
And
that's nice.
I think people who wants to look good should wear it and
Of
make use
course,
of it.
of
Make
course.
use of the technology.
Your smile reflects your personality, as you told before. Yeah. Now coming to this teeth whitening or teeth bleaching, this thing is also very kind of popular now.
Yeah.
That is good, really, or it's a chemical procedure?
Yeah. See, when it comes to teeth whitening or bleaching, as you say, see, basically we want to remove the discoloration on the teeth.
Okay.
So what kind of discoloration? Again, we have to look into it.
Correct.
Whether it's external stain,
Mm-hmm.
which happens due to tobacco,
Okay.
chewing, or nicotine stains for smoking. If you drink a lot of coffee, tea, and there are some stains will. So these are external stains. This can be easily removed with regular cleaning, polishing, and good polishing, and can get back your teeth color. But sometimes you have some stains like fluoride stains, which happens, intrinsic stains, because they are from the inside of the tooth.
Correct.
So those things we can't remove it, just by cleaning and polishing the teeth. So
Correct.
for that we need to use some chemicals. We use something called hydrogen peroxide, which is a very effective chemical for removing stains. So we use it in different concentrations, and we put it on the teeth and we leave it for some time, and we remove it. There are different protocols for it. We have something called office bleaching, home bleaching, and different type of protocols. So and we can use the bleaching depending on the severity of the discoloration is there. So we can use it in different sessions also, and we can get good results. Yeah, some patients do complain of mild sensitivity because we use chemicals
Correct,
on
yeah.
the teeth, but those are all part of the treatment. You need to understand, because we use chemicals.
Correct.
Sometimes it will be irritating, and we have to protect the gums
Oh.
from chemical contacting the gums. So these are all small, other associated risk factors with the treatment, but they are very, very, mild. That's not a major thing that you should not go for it. But again, if a dentist decides this case has to be, teeth whitening has to be done by bleaching only, then I think you can discuss with your dentist, and they will guide you accordingly, and you can definitely take the procedure. There is no harm in it.
Doctor, we are almost towards the end of our show. Thank you so much, and it was really interesting to know about all this latest technologies. Thank you so much.
Thank
Doctor.
you so much.
Yes, അങ്ങനെ നമ്മുടെ കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റ് ഇവിടെ അവസാനിച്ചിരിക്കുകയാണ്.